During the AOS 2010 joint plenary session by the Lancet Oncology and the Clinical Oncology Society of Australia, Associate Professor Danny Rischin from the Peter MacCallum Centre presented results from a large international phase 3 trial involving patients with oropharyngeal cancer. In this interview with Su Yin Ong from MedConnect South East Asia, Professor Rischin shares how these findings will benefit patients and impact their treatment strategies. Could you please share with us the key findings of your study?
What we did is we had a large trial which we conducted through the Trans-Tasman Radiation Oncology Group involving about 861 patients from 16 countries around the world, and we looked at whether the prognostic importance of the human papillomavirus in the subset of patients with oropharyngeal cancer, so cancers of the base of the tongue or the tonsil, to see, try and confirm from smaller retrospective studies that have been done previously the prognostic significance and implications of the HPV-positive group compared to the HPV-negative group. What we found was that of the patients we were able to test, which was about 200 patients, 60% of the oropharyngeal cancer patients had what we call evidence of HPV-positive disease, and that group did significantly better than the group that was HPV-negative. 2-year survival was 91%, excellent in the HPV-positive group. It was down already to 74% in the HPV-negative group. So what our study does, together with other data that's emerging, it confirms in large clinical trials what was previously suggested from small retrospective studies, that this is a major prognostic factor. And in fact, HPV-positive oropharyngeal cancer is a distinct entity. It's a different disease, has different risk factors, different biologic features, and importantly, different clinical outcomes with standard treatment, and they do much better. And I suppose what it sort of leads to is whether we should be treating this group as a different disease compared to the traditional HPV-negative head and neck cancer, which is associated with smoking and alcohol. This is quite a different group of disease with different, and the patient mix is quite different as well.
Could you elaborate on how these findings would benefit patients with head and neck cancer with or without HPV infection?
So I think the important what's emerging that's important is that this is really a distinct entity. It's a different disease, and we really need to be developing trials and treatments that are specific for the HPV-positive population and HPV-negative. So if we take the HPV-positive population first, it's quite clear that they do very well with standard treatment, but the question is whether we're over-treating them. So could we de-intensify treatment and still get excellent results without running the risk, ensuring that we still maintain excellent results with less acute and less long-term toxicity. We know that our current treatments for head and neck cancer with radiotherapy and chemotherapy are quite toxic, both in terms of acute toxicity but also in terms of late effects. And these patients are often a bit younger, they're from a different socioeconomic group, and they're going to live a long time, and most of them are going to be long-term survivors. So the challenge for the HPV-positive group is to actually see if we can come up with effective but less toxic treatments. And we are ourselves in the Trans-Tasman Radiation Oncology Group in Australia and New Zealand, and also the RTOG in North America, are in the process of developing trials that are specific for HPV-positive patients. But even if in trials that are not specific for HPV-positive patients, it's going to be very important to stratify by whether they're HPV-positive or negative, because this is now probably the most important prognostic factor and probably confounds our interpretation of previous trials and will confound interpretation of future trials if we don't take it into account. Now, for the HPV-negative group, which is the sort of what we tend to have in the past thought about with head and neck cancer related to smoking and alcohol, these recent results highlight that these patients the results haven't improved as much as we may have thought, that we've been lulled perhaps into a false sense of improving outcomes based on this increasing incidence of HPV-positive oropharyngeal cancer with a much better prognosis. So they're the group that we really need to target more effective and more novel therapies. and perhaps they're not a group in which we'll be looking to de-intensify, but we're looking to see if we can develop better therapies, whether that's with targeted therapies or other novel approaches.